Hi, this is Megan Burkett, and this is the final physical exam for the OSP in MSN 568. I'm here with my patient. She's a 25-year-old female, gravida 2, para 1, who's 33 weeks gestation and is complaining of increasing contractions over the past 3 days. She denies vaginal bleeding and discharge, and she does have a 2-year-old child at home already. All right. Hi, Tina. I'm Megan. I'm the nurse practitioner. So I can tell you're obviously uncomfortable, so I just wanted to ask you a few questions. When did you first start noticing your contractions?
About a couple of days ago.
Okay. And do you know how often they occur during the day?
No, I haven't really paid much attention to that.
Okay. Are you still able to go about your usual activities, or is the pain so bad that you can't do your usual daily activities?
No, I can do my daily activities.
Okay. Have you noticed when the contractions are better or worse?
Not necessarily.
Okay. And how would you describe the pain of the contractions? Is it achy, sharp, dull, or crampy?
Probably a little bit more crampy.
Okay. And have you noticed any rush of water, vaginal bleeding, discharge, anything like that?
No.
No? Okay. And then have you tried anything to help you feel better? Have you laid down, put your feet up, hydrated, anything like that?
I've walked around a little bit more if I'm uncomfortable. I've tried a little bit more water. That's pretty much about it.
Great. Okay. Now, did you have premature contractions with your first pregnancy?
No.
Okay. And any family history of preterm labor with your mom or grandmother or anything like that?
Not that I'm aware of.
Okay. Now, are you having any nausea, vomiting, diarrhea, or back pain?
A little bit of back pain.
Okay. And when do you notice the back pain the most?
Probably more in the morning.
Okay. All right. Any history of high blood pressure, diabetes, smoking, alcohol use? No, nothing like that. Okay. And then have you noticed any urinary tract infection symptoms like pain when you go pee or frequency or urgency, anything like that?
No.
Okay, all right. Well, what I'm going to do is I'm going to have you lay down and I'm going to just check the position of the baby. So I'm going to do what's the Leopold maneuvers just to check the positioning of the baby and see if it's in a breech position, if it's head down, where it may be laying within the abdomen. I'm also then going to do a pelvic exam, obviously. And what I'm going to do is use the speculum, and I'm going to assess the vagina for any discharge, bleeding, as well as the cervical os for any dilation at all. In addition, what I want to do is get some, as part of the diagnostic tests, I'm going to get a fetal fibronectin sample, and that's done with a swab that's taken from the posterior cervix. So obviously you're not going through the os, but you get a sample of the cervical and vaginal secretions behind the cervix if possible. I also want to get a urinalysis to rule out any infection, and also to check to see if she's dehydrated, because both dehydration and urinary tract infections, or STIs for that matter, can cause premature labor. So I'm going to go ahead and get my sample, bring it out, and then I will send that to the lab. With the fetal fibronectin, a negative result is a reliable predictor that delivery will not occur within the next 2 weeks. Whereas a positive result is less reliable because it's likely that the pregnancy will still continue for 2 weeks. But a negative result is a very good sign. All right, so I'm going to have you sit up, and I'll help you up. So what I'm going to recommend at this time is that we just wait and watch. What I want you to do is go home and try to rest as much as possible, hydrate, try not to lift your toddler, recruit family and friends to help you. But if contractions start to occur more than 6 times an hour, or if they start to get more intense, and last for a lot longer, then you need to go to the hospital, okay? Because then you may be actually in preterm labor, and there's medications that they can use to stop that, okay? I also want you to refrain from any sex, and then as soon as we get the results of your urinalysis, we'll send it to the lab, and the swabs, I'll call you and give you the results, okay?
Okay.
Do you have any questions?
No, I think that's
All
good.
right, thank you.
Thank you.